some imbalance in the depressed patients. And it's very important to draw the line here between the cause and the effect. Certainly if someone's depressed, there can be biological changes, they're under stress, all those things. But this idea, what we were really interested in, was evidence to say that the imbalance caused the depression, like it has in the advertisements.
Can I just say one thing?
Yeah.
The articles they referenced were extremely long, too. And if you waded through the whole article, in which you found that it actually supported our position, I mean, they pretty much
Right.
stated...
Most of those articles at the end say, well, you know, the evidence isn't really there, those kind of
Toby
things.
had his hand up.
Yeah.
Yeah, the question I had was on the prior slide, if you go back one. So the reply was basically stating that the measures of the 5-HT function were actually reduced, but again, it's correlational data. They're saying, yeah, we found some slight difference here, but the
Right.
advertisements are saying that it's causal, that the reduction, if any, that they found with the 5-HT actually caused the depression.
That's at least implied, if not directly stated. Depends how cute they're being in that particular advertisement. Dr. Moncrief.
No, I mean, there are some studies that show reduced numbers of 5-HT receptors, but there are studies showing the increased numbers
Right,
of 5-HT
yeah.
receptors. The evidence is completely inconsistent and contradictory.
Right.
There certainly is no consistent picture. There certainly is no consistent picture of a serotonin abnormality in people with depression.
Yeah,
And
we
equally
talked all
you can-
about this, the depletion studies and all that in our paper, and he's, you know, acting like it's pretty much good evidence.
That was actually one of the fascinating things for me was you're seeing where they think this is the best evidence. You're learning something about what people believe this, where they're getting their information from.
Now this is another one. This is a Dr. Richard Friedman, who is the head of psychopharmacology or some such department at Cornell. And he has a pretty, some depressed patients who have abnormally low levels of serotonin respond to SSRIs. So we emailed him and asked him how he was identifying those patients who have abnormally low levels of serotonin. And this is his reply. There's a lot of evidence for the role of altered serotonin transmission in depression. And he gives us a reference here, okay, by Nestler in Neurobiology of Depression. And we of course, pulled the article. And most of the article talks about the hypothalamic pituitary adrenal axis. It really has nothing about serotonin in there. So I emailed him back and said, well, I'm actually familiar with that article, but I don't really see it focusing on serotonin. There's really nothing in the article about serotonin. And if you could point to that section of the article that you have in mind, that would be great. And he emailed back, and this was pretty much the end of the conversation, and gave us another reference. So, here's another one about, at the bottom there, a patient with a chemical imbalance that leads to depression likely receives entirely different insurance coverage than a patient with a chemical imbalance that leads to hypothyroidism. Again, we emailed, and we get, every now and then we'd get a citation like that. Now, I emailed her back and said, well, again, it doesn't really show that low serotonin causes depression. And she emailed back, my comment about chemical imbalance that leads to depression was based on conversations I've had with mental health professionals. And she gave me a website, and we went back and forth, and this was kind of her final response here, which is sort of incredible from a reporter, I think. I'm not sure it's realistic to expect the general public to follow an explanation much more complicated than there may be a chemical imbalance in the brain. And I think that the general public can follow the explanation that no one has ever shown there's a chemical imbalance that leads to depression. It doesn't seem that complicated. Here's another one. This was a talk. A reporter went and heard a talk by this woman on suicide prevention who was talking about a chemical imbalance. And these are our exchanges. And she referred me to some websites. So, of course, that's the first block up there. And then I went and checked out the websites, and I didn't find anything about evidence in support of a chemical imbalance causing depression, and emailed her. And then her on the bottom, I did not have any specific research in mind, okay? When I stated that one of the reasons someone can be depressed is that they may have, whatever that means, I don't know. I mean, it doesn't really make much sense.
I just have a comment that,
Yeah.
here. It just kind of takes a step back from this, and something that always bothers me when we get to this level of discussion of treatment of depression is, what is depression? You know, there's this reification problem. We have this idea that there's this real world thing that's called depression, and then we can line up 100 people and separate out those who have it and those who don't. And I think that the criticism has to cut deeper than just the theory of what causes it, because I don't think we're talking about anything real. You know, I think we're talking about something that's a socially constructed concept. The idea that there is such a thing as depression that you have or don't have. So it's distorted from the beginning, and it's in a way almost ludicrous to be arguing about what causes something when you don't even have a clear-cut proof that there is something.
I agree 100% with you, but I mean, our mission was very simple. We want to see what evidence they're using to back up their own statements. And in getting just a simple reply to some of those questions was very difficult. Another one here, and this person never replied. Actually, and there's you can post comments to this one, and I posted our letter, but never got a reply. This was a Philadelphia Inquirer article about mental illness, and the statement, but mental illnesses are simply chemical imbalances, and it was a long reply. We kind of went back and forth, and she basically really didn't come up with much. She came up with one citation to an abstract written a couple of years ago, but her final statement there, I did not conduct an extensive literature search, as I assumed that if an individual, as the president of the Society of Neuroscience, among others, stated that a mental illness represents a chemical imbalance, there must be some evidence to that. And the citation was that this president was making a pitch to Congress for more money. Another one here, she's talking about the chemical imbalance theory. And this one kind of blows me away. The only information I have is what my doctor has told me. Okay, he said that for me, I make too much adrenaline. Now, this points to a problem with editors, I think. I mean, you would think that an editor of the health section might have looked at this person's article and said, well, what evidence do you have for this? Okay, how are you backing up your statements here? And if she had said, well, this is what my doctor told me, he might have said, well, we need a little bit more than that for the paper. And so it goes on and on. Oh, this was a good one. Let me back up. Again, act promptly and accept that they may have a chemical imbalance. And she referred us to just a psychiatrist somewhere. I guess we just find one. I guess none of the psychiatrists in this room who could talk all about chemical imbalance. And this is my favorite, the bottom there. Numerous studies have been done, and the research is definitely available and make a connection between mental illnesses and organic issues within the body. Actually, and then I wrote back, don't really care what psychiatrists say. You're the one that mentioned this, and what evidence did you use for this? And you said that there's, numerous studies out there, and it's definitely available. Could you just give us one or two of those? And never heard back from her. Right. So it goes on. Now, and this is an interesting one right here. This is not an op-ed piece or a newspaper report, but this is the governor of Massachusetts' wife. And I think she understands here what she's talking about when she says, I know that depression is really a chemical imbalance, which is triggered by systematic stress. Now, this is very different than saying that the sort of out-of-the-blue idea that someone's walking down the street and then all of a sudden serotonin is low and they're depressed. And this is a very different take than what you see in the advertisements and from the psychiatry profession. And she acknowledges, I've done a little reading in the time I've had. Again, another one here, just the chemical imbalance part. Needs to be looked at as a chemical imbalance, and we didn't get a reply. Now, this is an interesting one, the last one here. Sometimes it's the result of a chemical imbalance, and the author supplied a link to a quote from NIMH. So obviously, we went there and then followed up with the letter to NIMH. And this is their quote. This was on NIMH's website. Researchers believe that both depression and suicidal behavior can be linked to decreased serotonin in the brain. And it talks about low levels have been detected in cerebral spinal fluid. And this is where the results are, I mean, this statement is a real stretch, okay? So we asked NIMH for any advice, and they didn't really give us much. They said we should go do a PubMed search, okay? And we'll find lots of articles.
And Tom Insel, the head of NIMH, was recently quoted as saying, the fact that you're depressed doesn't mean that that your body is underproducing or overproducing anything. So he's actually quite, I mean, the head of the organization is quite clear.
And this was our reply to them. Are you sure this came from a scientist? Their reply to us. And that we know a PubMed search will reveal lots of hits on serotonin, but we are really interested in what they are using. This is a great quote here, and it almost makes, is someone here from McGill? It makes me wonder reading about this, because this is a very good summary of what we would say is a very accurate term, or somewhat accurate about a chemical imbalance. And it would be great if the drug companies would use a paragraph like this. True conditions caused by chemical imbalances are relatively rare. All thoughts, feelings, emotions in the brain are mediated by a release of chemicals in brain pathways. And it goes on. It's a very good quote. When was that? This is on there right now.
Right now.
Yeah, at least it was a couple days ago even. And then, do you want to comment about that?
Wait, go ahead, I got something else.
It brings up, is the theory really dead? And it almost makes it, that the way it's discussed, that there really wasn't a lot of credence given to the theory. And if you can imagine a field like physics and the theory of relativity, and if all of a sudden physics professors decided that that theory was no longer true, they would be publishing it in journals and writing about it and all that. But you can't find a mainstream psychiatry journal or professor to come out and openly state or write an article saying the theory is dead. Okay? There's some people in this room that might do that, but you're not going to find this in the American Journal of Psychiatry.
Also, as far as the whether this is rocket science or not,